help you? So, you're here for an allergy testing? Okay, let me take a look at our system. Well, I see that you have an appointment with Dr. Grisby at 4 p.m. Right on time. And it looks like you've already filled out all the paperwork needed, which is excellent. So, here, I just need your signature on this one form. Just sign right here. And then you can take a seat. The nurse will come out and get you just in a minute. Thank you. Hi, how are you? My name is Gracie, and I'm your nurse today. So, I know that you are here for an allergy testing, and before the doctor sees you, I just need to take your vitals. So please make yourself comfortable in this chair, and let me put on my gloves. So first, let me grab your temperature real quick. I just need this side of your ear. Right, your temperature is very normal. And then please hold out your index finger, and I will just get your heart rate. Perfect. Alright, this is absolutely normal as well. And then I'm going to get your blood pressure. Just let me help roll up your sleeves. Alright. And now I'm going to just wrap this around your arm. So if you can just relax for me. Yeah, just relax a little bit more. Very good. Alright. Alright, perfect. Now lastly, I just need your vaccination status. So this won't affect our today's testing, but I just need this information to put it on file. Okay? So have you taken the booster shot already? And do you remember when did that happen? Was that 3 months ago, 4 months ago? Okay. And which brand? Is it Pfizer or Moderna? Got you. And is it the same as your first two vaccines, or is it a different brand? Got it. Perfect. Then we're all done with this. Please wait here and I will call Dr. Grisby to help you with your exam. See you later. I'm Dr. Grisby. Nice to meet you. So, could you tell me what have brought you here today? Did you have any allergic reaction recently? I see. So you felt itching, swelling, and then you felt difficult breathing. When was that? 2 weeks ago. And did you do anything different on that day before your allergic reaction? I see. So you ate some seafood dishes for dinner? And then you went to exercise. What kind of exercise was that? I see. Dancing. Do you still remember what exact foods you've eaten for that day? You brought the recipe here. Perfect. So let me take a look. Okay. So there's scallions, ginger, garlic, lime, and shrimps, green beans, and sesame seeds. Alright, I got them all noted down here. And did you go dancing again days after that episode? You did? And that was all fine? Okay. And is this your first time getting allergic? Yeah, did you had any allergic history before? I see. So you have allergic symptoms in spring and summer? And for many years. Okay. But just nothing like this serious. Gotcha. Okay, so don't worry. Here will help you find what caused that serious allergic reaction 2 weeks ago, and then we'll see what we can do to work with it and help you to try to avoid it as much as possible in the future. Alright? So I'm just going to do a very simple skin test. Could you roll up your sleeves up to your elbow and show me this side of your arm? Very good. And now I'm just going to use my fingernail to lightly rub the skin on your right arm. And let's just wait for 3 seconds. So, what do you see now? Exactly. So the skin where got rubbed by my finger, it shows a little red, right? I wonder, have you ever noticed that if you take a really hot bath, or that if you wear a pants where the rubber is very tight, that you may get rash sometimes because of this, right? Yeah, so not everybody is like this. Only 5% of people are like this. And this is when our skin released a lot of histamine, which is causing allergy. So now I would like to take a look at your nose and your throat. Let me just wear the gloves. So first, I'll take a look at your nose. If you could just tilt your chin towards me. Good. So firstly, I'll take a look on this side. And the other side. Okay. And then your throat. If you can just open your mouth. And good. Perfect. So they both look good. I don't see any problem. And now if you can just sit up a little bit for me and relax. I'm going to listen to your lungs. And please take a nice and deep breath. So breathing in and breathe out. Very good. And breathing in and breathe out. Perfect. And now I'm going to listen to your back. So I just need you to again take a few more deep breaths. So breathing in very good, this side. Just breathing in and breathing out. Very good. Perfect. So your lung is nice and clear. So now what we're going to do is that we're going to do a skin test to test out all the potential allergens. This includes both the environmental allergens like trees, grass, pollen, and also the food allergens, especially the ones that you mentioned that you had that night. And for us to know that the result is accurate, we'll need to control the positive and negative factors. The positive factor here is histamine, and the negative factors are salt and water. But if your skin reacts to salt and water, then we have a problem here. The test will no longer be meaningful. So as part of this test, we'll also test out how your skin reacts to histamine, water, and salt, and to make sure that your skin reacts as expected. Does that sound good? Perfect. Then I will let Nurse Gracie to prepare and carry out this testing for you. Hey, sorry for the wait. So here are everything we need today. We've got a lot to test today, so I will also need to use your bag for those food allergens. Do you maybe have a t-shirt that you wear underneath that is easier to pull up? Perfect. Then if you could take off your sweater for me, that would work perfectly. Thank you. And can you hold out your arm like this? And I just need to mark the middle with this marker here. And 1, 2, 3, 4, 5, 6, 7, and on the side 8, 9, 10, 11, 12, 13, 14. Very good. And the other side. So I'll need to mark this. Again, mark the middle. And 1, 2, 3, 4, 5, 6, 7, and 8, 9, 10, 11, 12, 13, 14. Good. And we will use this spot for testing histamine, and these 2 spots for water and salt. Alright. And I will also need to mark your back, so if you can just turn a little bit towards this side. Very good. And let me help pull your t-shirt up a little. So we will have a little bit less to test on your back, only 10 in total. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Now we're going to touch your skin with these different allergens, one at a time. Alright, so let's start with the thumb first. Alright, and let's move on to this side. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14. And now let me put this histamine here. And then here's water, and this is salt. Alright, so we're done with your arms, and now let me move on to your back. So, and again, let me just roll up your t-shirt a little bit. And okay, we only have 10 on your back, so 3, 4, 5, 6, 7, 8, 9, 10. Perfect, we're done. So let's wait for about 20 minutes for your skin to fully react. And feel free to put your sweater back on if you are cold. Alright, then I will check on you later. Hey, how are you? I see that these are coming up now. Some swells are pretty big. Let me look at your back. Well, your back actually looks pretty good. So I will need to measure the swells. And the bigger they are, it means that the more allergic you are to them. Alright? So if you can just hold up your arm like this for me, and on this side first. So let me take a look. 2.5, 3.1, 1.2, 1.8. Okay, 0.5, alright. So 0.8, on this side, please. Thank you. 0.6, 3.8. Okay. And this side. 2.8. And your back. Just pull up your shirt a little. Okay. 0.5. 0.5. So, I don't see that any of the food we tested caused you any allergy. I only see that your skin seems like reacted a little to lobster, but I think the reaction is too minor to even say that you're allergic to it. Alright? So now I've got everything noted down here, and I will ask Dr. Grisby to take a look at it. Let me use this to wipe off the markers on your arm. Okay. this side. Perfect. Then I will call Dr. Grisby to take a look at the results, and I will see you later. So I've taken a look at your results, and it turns out that you are not allergic to any of the foods that we tested today. But you are allergic to quite a few environmental allergens, like trees and grass are the ones that you are most allergic to. And you probably feel the strongest allergic reaction in spring and summer when the grass and the trees start to sprout. And for your serious allergic reaction 2 weeks ago, it's most likely because you exercised right after you ate dinner. So strong allergic reaction can happen if we go for exercise too soon after we've taken some food, especially that this is in the spring season and your body is probably already having some allergic reactions. So my advice is that try not to exercise too close after having food. Normally, we would suggest having a 3-hour gap in between, but I know that this must be really difficult. So try at least not to exercise for 2 hours after having food to begin with. And today, I will subscribe you an inhaler and an EpiPen. So you use the inhaler if you feel that you have some difficulty breathing, while for the EpiPen, it's emergency use only. So use it with great caution. And after you use it, you have to call 911. So not to call the urgent care and not to call us, but 911. Alright? So then I will ask Nurse Grace A to show you how to use them. And please take care. Alrighty, so I see that the doctor prescribed you an inhaler and an EpiPen. So let me show you how to use them. So have you used an inhaler before? Okay, no problem. So let me show you. So this is an inhaler, and it has a cap here. And you need to take the cap off and shake it well before you use it. And then open your mouth and put this in your mouth. Okay? And then breathe in slowly and deeply. And while you're doing that, press right down on here. And that is 1 puff. Okay? And for this particular one, you can use 2 puffs continuously. But if you still need more, then you will need to wait for at least 1 minute in between. Alright, and after that, you just breathing in slowly for 10 seconds, and then breathe out slowly. Alright, so that is for the inhaler. For the EpiPen, you can remember it like this. So blue is for the sky, and orange is for the side. At this orange side, there's a needle inside, and when you want to use it, you need to twist and open this orange cap. Inside, you will see orange tip, okay? And then you will need to pull this blue cap to release it. And afterwards, and you'll just need to push this down onto your outer side. Okay? And then wait for 3 seconds for the drug to release. But remember, so this is only for emergency, and you only use it for life-threatening situations, like for example, you're feeling that your throat is closing out and you cannot breathe. Alright? And you have to call 911 after using this. Okay. Is there any question? Perfect. Then it's very good to have you here today, and I hope you have a nice day. Bye.